Let us begin. Thank you everyone for joining this webinar today. This is a webinar hosted by myself, Dristan. I'm the project manager for the Gateway to Global Aging Data. And in particular, in this webinar, we're going to focus on using the Gateway to Global Aging Data, this web resource that we've built here, to understand health and retirement surveys around the world and how to analyze them. And in particular, focusing on the CHARLS survey, the Chinese Health, Aging, and Retirement Study, which is conducted in China, and in particular using a harmonized version of that data set, meaning a kind of very user-friendly version of that data set, which is meant to be used with other international aging studies conducted in a similar way around the world. And that's one of those things that we produce here at USC. If at any time you have any questions throughout this webinar, I'd encourage you to ask a question. You can do that in the question panel or in the chat panel, or if you'd like to ask a question out loud, if you raise your hand, I'll try to keep an eye on that and I can unmute you and you could ask that question out loud. We'll also be making a recording of this webinar and the slides will be available, as well as the data creation code that we're using today will be made available. You might also notice that there are two handouts. These handouts are named Advanced CHARLS Webinar 2008, Part 1 and Part 2. Though these appear to be .doc files, these are actually .do files. So if you'd like to run these in Stata, if you have the Harmonized CHARLS data and the Harmonized ELSA data, which we're going to be using for today's webinar, you can run those on your own. You just need to remove the C from the extension. So instead of a .doc file, just rename them as a .do file, and those are actually Stata files. You can also just open them in a Word editor and look at them if you wanted to know the syntax. But you're also welcome to just watch and follow along as I'll be showing everything on this screen. All right, well, let us get started. So this is an advanced webinar, meaning that I'm assuming everyone has some familiarity with the Gateway to Global Aging data, with the International Family of Health and Aging Studies, which are conducted around the world, and with the harmonized data sets, which we produce as part of the Gateway to Global Aging data. If you haven't, I think you could probably still enjoy and learn from this webinar, but I would also maybe suggest to go back and watch an introductory webinar. Those are all available on our website, and I'll show you where to find those. And it's the same place that this webinar will be available after we finish today's webinar. So today, what we're really going to focus on is actually using this data itself. We're going to talk about creating variables, conducting some really simple analyses, and things like weighting, which people often have questions about when getting started using these nationally representative large population surveys. So what we're going to do today, first we're going to do part 1 of our analysis is going to be just using the Harmonized CHARLS. And then for part 2, we're going to do a cross-study analysis using the Harmonized CHARLS and the Harmonized ELSA. And again, Harmonized ELSA is a data set that we produce here at the Gateway to Global Aging Data. And it's a user-friendly version of the ELSA data. That's the English Longitudinal Study on Aging, and that's conducted in England. So let's start with a research question, just as a way to get started. So one of the things that we're going to look at is, are there differences in financial support to children across different ages? So for instance, we know that in certain cultures, it's much more common for people to support, to give money to their children, even their adult children. And so we wonder what that looks like, and maybe we can see some differences for people at different ages. And again, to begin with, we're just going to look at this question in the Chinese context using the CHARLS data, and then we'll expand this question in part 2 to kind of compare what we find in the Chinese population to the British population in England. So the steps to do this are we are going to download the Harmonized CHARLS dataset. We're going to identify our relevant variables. We're going to create additional variables. We'll apply weights. we're going to analyze giving to children for the full Charles sample, and then we're going to analyze giving to children for different subpopulations inside the Charles sample, and particularly subpopulations as defined in different age groups. So to start with, you would download the Harmonized CHARLS, and you can do that at this link. I'll also take us over to the Gateway to Global Aging Data website, and I'll show you how you can also find that here. So this is the Gateway to Global Aging Data website. It's at g2aging.org. You can click on this, first we'll click on this survey tab here. And this would show you all the studies which are currently part of our network and that we work to provide information about these studies to researchers. You can see Charles here, which is conducted in China. If you wanted some more information about the Charles sample and how Charles was conducted, you could use this study overview tab. So this would tell you things that like inside of Charles, anyone age 45 or over is eligible. Charles, like all of these studies, is a longitudinal survey. So people are interviewed once, and then usually in around 2 years, they're interviewed again, and then 2 years later again, and until end of life. You can see that in Charles, one age-eligible person per household is interviewed, and then the spouse is also included regardless of their age. So for instance, you might have someone who is 50, whose spouse is, say, 40, and even though that spouse is not age-eligible to be a respondent his or herself, they would still be included and surveyed as part of Charles because we know that the effect of a spouse has a lot of has a great effect on an individual. You can also see that Charles is conducted in person and some more general information about Charles. But let's talk about how to download the Charles data. So if you click on the download tab, you can see here Charles. We have a link just to download the original Charles data if you would like to download that. You can download the Harmonized CHARLS, so that's the link we'll follow. You can also, I suggest, download the Harmonized Codebook, and we're going to look at that, and that's going to tell you information about every variable that's included in the Harmonized dataset and how it was created and how it might be different from variables in other Harmonized datasets. But for now, let's just follow this link in the Harmonized CHARLS. So you can see here, you can download the data files by clicking here on Harmonized Datasets. You do have to be registered with Charles and request access to this, which takes a little bit of time. So you'd want to have requested access to the Harmonized CHARLS, and then you could download the Harmonized dataset. So let's say that we've already downloaded our dataset. We've also downloaded our codebook. Here, this is in the documentation. And the other thing that I'll mention that we provide is we do provide all the programs we use to make the Harmonized datasets. And these can be helpful if you want to check our assumptions or you'd like to change something about how we created a variable. So we do provide, these in this case are stata-do files. And you can also download these here. So we've got our Harmonized CHARLS dataset. The next thing we want to do is we want to identify our relevant variables for our analysis question. So in this case, we're going to be using Charles Wave 4. This is the most recent wave of Charles. And this was conducted in 2015. And here are some of the main variables we're going to be using. We want a measure of, in this case, we're going to say of whether any giving to children, any financial giving to children. And this is a variable called H. H because it's a household level variable conducted in Wave 4. As I said, these are longitudinal surveys, so we would also have this measure for Wave 1 and Wave 2 of Charles also. We're going to use a couple identifier. All the harmonized datasets are individual level, meaning each observation or each row in the dataset is one person. But what we're really looking at today is going to be something that's true of a household. We generally think about people giving to children, that two people or an individual themselves would have a child, but not that two individuals would have the same children. So kind of sets of people. which is why we're calling this a household variable, starting with an H in our variable name. We're going to use the respondent age. This is in a variable called R4, AGEY. So again, respondent in wave 4, their age in years. Hopefully these our variable naming convention is starting to make sense here. We're going to also use spouse age. And then we're going to use a household analysis weight. Because again, we're looking something at the household level, whether giving to children. And this variable is R4WTHHA is the name of that. So if you have downloaded the Charles dataset, there's a couple ways for you to find this if you downloaded the data and documentation. I think the easiest way is to use the Harmonized CHARLS codebook. So I will bring that up here. You can see it's over 400 pages, so there's a lot of information in there, but we do try to organize it. So for instance, if we were looking for something like an age variable, if you wanted to know where to find that, one thing you could do is just Control F and find age. But we also divided things into sections with our bookmarks. So you could just scroll down through demographics, right? Age would fall under demographics, and you can see here we have age in years. And we have these variables for each year of the survey. R1, so that's wave 1, R2 is wave 2, R3 is wave 3, and R3, or wave 3 in Charles, was a life history survey. So it's not kind of a regular core interview, but it's still included here. And then this variable, we're going to be using age in years for wave 4, which was conducted in 2015. You can see here we have information about how it was constructed, what were the variables that we used in it, and then we list out the Charles variables used. So that's one way. Also, if you have the Harmonized CHARLS dataset already open, so you can see here inside of Stata, you can use your variable browser, and we try to include variable labels that are informative for everything. So for instance, you could just search for age in years. And you can see here, you get R1 AGY, and it's quite clear. So this happens in wave 3, wave 4, age in years. Or you could search for something like children, and you can see all those variables which are related to children. And then you could identify here our variable of whether any transfers to or from children or grandchildren. So it's another way to kind of find the variables that are of interest to you. Okay, so at this point, we're actually going to start using some Stata code. Again, if you'd like to use that handout to follow along, you can, or you can just watch here in the screen. So the first thing we're going to do is, because I mentioned these harmonized datasets are respondent level datasets, so one individual is a record or an observation, and maybe it would be helpful to actually just look at our data. So here is exactly how the Harmonized CHARLS dataset is structured. So you can see here we have an individual ID. This is person 1 and person 2. These people exist in the same household, within the same community. And again, we have here person 1 and person 2. So everything is going to be structured in this format. And we have some variables which are going to correspond to the respondent themselves, and they might be different than their spouses, and some variables which are going to be true for both the respondent and the spouse. For instance, questions about their children, questions about the house that they live in, questions about their assets. Usually those are thought about things that are shared by a couple. Of course, if the person is unmarried or is widowed, that person would just exist in their own household. So one of the things we're going to do is, because we are using this respondent level data set to look at something household, we want to make a household tag. Basically, we want to make sure that we're not overcounting, we're not kind of overweighting our analysis towards couples with 2 people instead of kind of a couple with 1 person, just meaning a single person or an individual. So we're going to use this this command in Stata. This isegen, which is kind of an enhanced generation command. And we're going to say create this variable, generate this variable we're calling h4 couple tag, and is equal to tag at h4 cup ID. And let's actually just run that inside of Stata. So I've got Stata open here. I'm going to say do this in Stata, and we'll open up our part1 do file. So you can see the first thing here is I just kind of look at some variables that we overview. So here is our whether giving two children variable. It's coded as a 0 and a 1 variable. It's a binary, and it's yes. They will correlate to no and yes. You can also see our age variable here. So our ages run from very small of 41, all the way to someone who was 115 in this wave. And then we can make our couple tag. So here is this command, theegen h4 couple tag is equal to tag h4 cup ID. And then maybe just to get an idea of what that's doing here, I've listed out exactly what happens. So let's say we have couple number 1 here, and this is made of 2 people, person 1 and person 2, and then we're only going to give a value of 1 to one person in that couple. So you can see how that works here. In the case that, let's say, couple number 6 was a single person, they lived in the household by themselves, they were unmarried and unpartnered, they would get the tag by themselves. So this is going to be important for our analysis because we're doing a household level analysis. The next thing we're going to do is we're going to create a couple age indicator. So age is something that every individual or person has on their own, right? But we're thinking about a household here, a couple or a single person. But in a couple, it's more complicated, right? So we have 2 ages, the age of one person and the age of the person they're partnered with. So what we're going to do here is we're going to use the minimum age between those. So for instance, if one person in the couple's age was 50 and one person in the couple's age was 49, we're going to assign our couple age as 49. In general, in most countries, this is going to reflect the age of the female in the household if there's much of an age difference, because women historically tend to marry slightly older. And then the other thing we're going to do is we're going to, instead of just using ages as a continuous variable, we're going to use another egen command here, and we're going to cut this variable, and we're going to cut it at different points. So these are going to give us age categories. So we're going to cut it at 50, at 60, at 70, and at 80 and over. So it's going to give us 4 groups. So those are going to be 50 to 59, 60 to 69, 70 to 79, and 80 and older. So those are how our groups are going to work. So let's go back into Stata. You also notice that I'm just kind of, if you're following along with this in Stata, I'm typing Q. So I've built in pauses into this data command. So if you just hit Q, you can go to the next step in this data command and it'll stop there. It's helpful to look at your results and then move on. So you can see here are those commands that we just looked at on our PowerPoint. And then we can kind of tabulate that age category. So you can see in the 50 to 59 range, we have about 31% of the whole data set. And we got over 6,000 people. There's also a large group of people, 60 to 69. 70 to 79 gets much smaller. It's about half the previous group. And then we really don't have a lot of people who are 80 and over, so less than 1,000 here. So we just want to keep that in mind in interpreting our results. It might be harder to say something about this older age group because we just don't have enough people. So now we're going to apply our weights. One thing that's nice about Stata is that it has a lot of built-in tools for analyzing survey or population data. And one of those is this svyset command. And this is kind of the preferred way for telling Stata information and using survey data about weights, about clustering, or about stratification. And those can be really important. And because Charles doesn't provide stratification or cluster information, so we really just have our weight that we're going to take into account. So all we need to say here is svyset, and then we're going to say p weight, meaning a pw, meaning probability weight, is equal to that weight variable that we identified. So R4 WTHHA. So back inside of Stata, we can apply that. We can also find out a little more information about it if we wanted to, using SVYDES. So it'll tell us, it's kind of assuming that everyone is in one stratum. We have 20,000 people, 20,000 units or observations in this stratum. So how those things are weighted there. So now we can estimate. So first we're going to estimate the frequency of giving to children for the full Charles sample. So anyone who's included in Charles sample, regardless of their age, we're just going to get a mean of this variable. And as I said, one of the helpful things about Stata was that svyset command, because what that allows us to do is once we've told Stata how our analysis has been weighted, then as long as we remind Stata that we told it how it should be weighted, you don't have to specify the weight or the cluster, the stratification for every command you use. And you do that using this svy comma or svy before your command. So it's going to take that into account. So here we say svy, and then we're going to, remember, we want to specify our subpopulation, meaning that we don't want to, because it's a household level variable that we're looking at, we don't want to double count for two people of the same household. So we're going to say if our couple tag, and this is just kind of shorthand for if couple tag is equal to 1, then give us the mean for this whether providing any financial support to children variable. So let's look at that inside of Stata. So we can see what we would estimate is that for the Charles sample, the sample which Charles represents inside of China, which is people, it's meant to be representative of people 45 and older. We would estimate that around 47% of those people report in the last year providing some kind of financial support to their children or to their grandchildren. You can also see our standard error, which is pretty small in this case, and our confidence intervals there. And again, I said what we wanted to maybe look at is whether there's a different pattern for people at different ages. So do we see that this is kind of consistent throughout all the ages of Charles, from 45 all the way to 115? Are we kind of seeing similar levels of support, or is it maybe somewhat correlated at different ages? So we can do that by using exactly the same command, but just changing our subpopulation slightly. So we can say if our household age, that age we defined being the youngest person in the house in our couple household here, is between 50 and 59, we can calculate the mean. And then we can do it again for people who are over 80 in this case, right? So 80 through 110. We can also calculate the mean. So back inside of Stata. So for 50 to 59, we would estimate, that around 46% of the Chinese population, 50 to 59, would provide some financial support to their children. You can notice that this is just really quite on par with what we saw for the overall Charles sample. And so then now let's look again for our oldest sample. So you can see it seems to be quite a bit lower here in this estimation. We would estimate that around 23% of people provide some financial support to their children. One of the things you'll also notice is that, remember, we had so much of a smaller sample size here with our older age group. So our standard error is quite a lot bigger here in this second estimation than it is in the first one. It's twice as big in the second one. We could also look, you can also do this kind of in one step. And you do that using, again, you're going to see the same command. So svy subpop. You're going to take a mean of our variable, but we're going to add one more option on the end, and that's going to say over our age category variable. And what that's going to tell Stata is to calculate this, in this case, 4 times. So for each of the values of our age categorical variable, we're going to calculate this. So we're going to get 4 estimates. And this also allows us to test the difference between estimates. So this is a post-estimation command inside of Stata. So we can test our estimate for our any given to children, grandchildren, for subpopulation 1. That's our 50 to 59 age group. We can test whether that is equal to our estimate of any given to children for subpopulation 4. And in that case, this is that 80 and older age group. So if we do this inside of Stata, you can see here we have our 4 estimations. So we see, just like we did before, that for our youngest age group here, it's at 56%. For our oldest age group, it's at 23%. And you can kind of see for our 2 middle age groups what their estimates are there. And then we can test whether our difference between our first estimate and our last estimate are statistically significantly different. And what we see here using an adjusted wall test is that we have a p-value here of 0.000. So I think we can probably say significantly that this financial support, we see, a real strong and statistically significant correlation with different age groups. We can also look at this graphically, which is sometimes nice. So what you can see is that across all age groups, we see financial support going down. So for people in their 50s, it's around, we saw 46%, and then it goes down quite significantly throughout all ages, and then is much closer to just a little bit above 20% there at our 80 and over age group. You also notice here we have confidence intervals, and so again you can see our confidence interval is much larger for that 80 age group, and that's because we have a smaller sample size. So it's something we want to be aware of in interpreting our results. So let's do the similar analysis. And again, I said what we're going to focus on here in part 2 is doing this kind of in a cross-study way. So we're going to do this kind of a similar analysis, but instead of just looking at our age gradients inside of China, we're going to look at our age gradients inside of China and how they compare to our age gradients, similar age gradients inside of England. So this is often how people do analyses between different countries. So of course, there are many things that make different countries different. So it's often not so interesting to say, well, in China, you can see people just support their children more often than they do in England, right? That's something we might assume. But it might be more interesting to say, you see a pattern, an age-related pattern in China going in one direction, and it goes in the other direction in England. Or you see a gendered pattern in China and a non-gendered pattern. There's not a gendered pattern in England. And this is called a kind of a difference in difference approach. So it's saying that there's a difference that's happening over a certain, and how things are correlated to a certain set of people in one country versus the difference in how things are correlated along the same characteristics in another country. So that's what we're going to be looking at. So how does financial support to children in England compare to financial support to children in China? And do we see different sorts of correlations across different ages? So we're going to be using the Harmonized CHARLS, which we already have. We're also going to be using the Harmonized ELSA. So we already have the Harmonized CHARLS. We know what variables to use there, right? So we're going to focus here on ELSA. So we're going to download the Harmonized ELSA. We'll identify relevant variables in the Harmonized ELSA. We're going to create a pooled data set. This is sometimes called a stacked data set with observations from both harmonized data sets. We're going to prepare our variables. We're going to apply weights. We'll talk about how to weight using information from 2 different studies. And then we're going to analyze giving to children across countries. So just kind of a difference approach. And then we're going to analyze giving to children across ages and countries. And we can look at to see if we have a different pattern in these 2 different countries. And that's kind of a difference in difference approach. So if you wanted to download the Harmonized ELSA, you would download that from the UK Data Archive, which is available at this link. If you wanted to see this on our Gateway to Global Aging Data, you could go back to that download page, and you could just follow this link here to download the Harmonized ELSA So you can see it's available here at the UK Data Service. If you're more familiar with Charles, all of these data sets are provided to anyone internationally. As long as you're doing research, there is no fee for any of these data. They're all publicly made available to anyone in the world, which is part of what makes them powerful. All right, so we've got our data now downloaded. I do have the Harmonized ELSA on my laptop here. And then we can identify our relevant variables of interest. So I showed you before kind of two ways to find these relevant variables, and one is using the code books, and the other is using the variable labels inside of the data set itself. I'm going to show you one more way here using ELSA, as the Harmonized ELSA is the example, using the Gateway to Global Aging data. So we have a tool in our concordance search, which you can see here at the top. So for instance, so we're going to select Harmonized ELSA. Again, we're interested in 2015, so we'll say 2014, which is when ELSA had their Wave 7. And we're going to look at, we're looking for information on family financial transfers. We also need information, a couple identifier. We saw that we needed that. And we also need some analysis weights and age at interview. So these are the variables that we want. So if you want to find these variable names, this is kind of a third way to find them. So you can see search results here for particularly our year of interest, which is, as I mentioned, is Wave 7 of the ELSA. So you can see here our different variables. So there's our couple identifier. Here we have a couple different kinds of weights. We can see one's for a core sample, or one's a longitudinal weight, and one is a cross-sectional weight. We have our age variables, and then we have that same variable that we saw of any financial transfers given to children or grandchildren. And this is kind of the power of using these harmonized data sets, is this variable is constructed the same way in both of these data sets, even though these studies were done in different parts of the world using different survey instruments, correlated but different survey instruments. And so we tried to provide as consistent a measure here in this variable of any financial transfers given to children or grandchildren for both these different studies, so we can compare things as we're going to do here. So we've identified what variables we're going to use. So now we're going to create our pooled data set. This is going to have variables and observations from both harmonized data sets. So the first thing we can do is we can read into Stata memory. That's how Stata works, is it brings everything into working memory. So we can read in these variables that we already identified for Charles. The current Charles data set is version C, so we're going to say using HCharlesC. And then we're going to append using HELSA. ELSA is on version, Harmonized ELSA is on version E. And then we're going to say append, and I'll talk about what append means. And then we're going to say keep, and we're going to list just those variables we're going to use from the ELSA data. Another way to do this would just to bring in every variable from HCharles, from the Harmonized Charles, and every variable from the Harmonized ELSA. There's a few reasons you might not want to do this. One could be, depending on your version of Stata or whatever statistical analysis package you use, they might limit the number of variables that you can use at one time. So here we're just going to bring in those variables that we use. This will also keep kind of the memory, you won't run out of memory also on your machine. So this is kind of a best practices here, although you could just throw in all the variables if you wanted also. So let's go into Stata, and we're going to clear out the data that is in there now. So that was the HCharles data. We're going to clear that out. And we're going to do, and then here I'm going to open up our, our handout. And this is the part 2 webinar handout. And again, if you downloaded it, you just change the extension from .doc to .do. So you can see the first thing we do here is we load in the Harmonized Charles. You can see in our variable pane here, so we're just going to get just those 5 variables that we specified. So nothing else is in there. We've got all the observations, all the respondents for Charles, but just these 5 variables. Our next step, we're going to append. So what a pin does is it takes all of the observations from this next listed data set and it puts them below the current data set. This is sometimes why this is called a stacked data set, because you have basically one data set on top of the other. So if we want to look at this visually, we can probably find the breakpoint here, right? So yeah, so you can see right here. So here on the bottom left, we have these are Charles respondents right here. And then you can see kind of on the top right, these are ELSA respondents. Now, you know they're ELSA respondents because they have values for those ELSA variables like H7 cup ID. And these are the Charles respondents because they have values for H4 cup ID. So you can see this kind of breakpoint right here between the Charles and ELSA respondents. The last thing that we do is we want to just make sure that we know where everyone came from. And we do this by telling Stata here in our append command to also generate a variable telling us where the observations came from. We want to make sure we know who is from the Charles dataset, who is from the ELSA dataset. And then we can recode this variable and we can clean it up a little bit. We can say anyone with a value of 1 is China and a value of 2 is England. So we know where they came from. The next thing we're going to do, and I'll just briefly mention this because this is only an issue depending on which studies that you had, which studies you're using for your analysis. But as I mentioned, what we're looking at is something household level. And ELSA does not release a household level weight. They do release individual level weights. So you need to decide what to do with that. And in this case, what I decided to do for this analysis is to just use the smallest respondent level weight for any respondent who's in the household. So how weights usually work is first they weight for kind of the probability of being selected as a household, and then within the household, the probability of being selected as a person. So for instance, how a weight might be helpful is perhaps for the age group 50 to 55, which is maybe when people are still working. It's a little less likely to find a man who's able to be interviewed when the interviewer comes to their house than a woman, because men are more likely in that age range to be at work during the day. So it might mean that you have an underrepresentation inside of your sample of men. So what this weight would do is it would take all those men who are that age range who are a little underrepresented in the sample for what we know is true of, in this case, the British population in England, and we would make that adjustment. So all of their responses are going to be counted a little more to kind of represent that group which is underrepresented in the ELSA sample. So in this case, we're just going to create, a fake household level weight for ELSA by using the minimum of any of the any of the respondent level weights represented by that couple. There's of course different ways to do this. You could choose one of them randomly. You could take the maximum. So I'm not suggesting this as a strategy for everything. I just want to let you know what I did here in case you run into any similar sorts of issues. Now, one of the things you noticed is that we use wave numbers in our variable names. So for Charles, all our variable names had a 4 in there for wave 4. And in ELSA, all our variable names had a 7 in them for ELSA. And it would be hard to analyze something because, again, as we saw when we looked at the data set itself, they're kind of in two different parts of the data set. But we want to create kind of one variable or one column, which is information for people of both surveys. That's how we'll do this analysis. We're going to have a variable with values for both surveys. And in that case, we're going to start using year wave numbering. So we're going to make a variable called H2015 TCANY. And all that we're going to do here is we're going to say take the values from H4 TCANY if this person is from the Charles survey, and take the values from H7 TCANY if this person is from the ELSA survey. And we're going to do this for all our variables. So we'll do this first for our childhood giving to children variable, our weight variable, we'll do the same thing. We'll do it again for both our respondent variable, our respondent age variable, and our spouse age variable. So let's do that inside of Stata. So we've got those variables. The next thing we want to do is we're going to create a couple tag, just as we did for Charles, to make sure we're kind of not over-representing households that are made up of 2 people instead of 1. So again, we're just going to kind of create a year-specific variable name, and we're going to give it those values which should be given for Charles and should be given for ELSA. And then we can use the same egen command and with tag here, and we just need to say that the instead of just using the H5 cup ID, we're going to also specify country. So it's kind of going to do a cross tabulation in there. And this is helpful if, for instance, there could be a couple, there is actually a couple 1 in Charles and couple 1 in ELSA. And this is, of course, not a couple of 4 people. These are 2 people in 2 different countries. So by specifying country in our tag command, it'll cross tab, so it won't combine any of those values. Then we can create age categories, just as we did before. So again, we'll still take the minimum of any age of a person in the couple, and then we'll divide it by the same 4 age categories. Okay, and if we wanted, we could just tab our age categories here, and we could also cross tab by country. So you can see here we have a much larger sample size for China. So we have over 15,000 people, a little bit smaller in England, but still a great sample size of 9,000. And you can also see that in England, we definitely have some people at older age groups. So it might be a little easier in England just because of our sample sizes to say something about older populations in England. So that's always a great thing to check is know your sample sizes. How many people are you deriving any statistic from? So now again, we're going to apply weights. And we've made that weight variable, and we put the values from the Charles weight and from the ELSA weights in that same variable. So then what do we do with data? Because we can't assume that that weighting means the same thing in Charles as it does in ELSA. And so how you can do this inside of Stata is to specify your country as a different strata, basically. So one stratum is England and one stratum is China. And that's going to let Stata know that those weights are specific to that particular stratum. So it's not going to try to correlate or try to adjust the weights across different countries. It knows to keep them separately. But again, it's quite easy to specify this in Stata. It's just 2 extra words. If we look at kind of descriptively, you can see here that we have stratum 1 and stratum 2. This stratum 1 here, in this case, is Charles. We can see that we know it's bigger, and then ELSA there in stratum 2. So first, let's just estimate frequency of giving to children by country in both studies. And in this case, we're going to just limit it. Of course, we want to say if it's a couple tag, right? We're going to make sure we're only counting 1 couple, 1 observation for each couple in our calculations. And let's only look at people or households which have a couple age of 50 to 110. This is important because although Charles starts at age 45 to be representative, ELSA doesn't start until age 50. So we want to just make sure at this point we're comparing similar age groups. So we're going to lose some people in Charles for this estimation, but we know that. And then again, we're going to use this over option, and we're just going to say over country. So we're going to get 1 estimate for China and 1 estimate for England. So you can see here for China, for this different age group, we're going to get a different statistic from before, because before we allowed anyone inside of the Charles sample estimate, but we're around 39% here of people who are of families or couples in China who are age 50 and over. we would estimate about 39% of them give financial support to their children or grandchildren, where it's much lower for England. Right here we see just 22%. We can also look at this graphically. And you can see there are standard errors. So these definitely look very different. So something you can see different levels of support, financial support for children in these two different countries. But again, I think what might be more interesting in just saying that there is a difference is to talk about how this difference is different in different countries. We just had a question by Human, and the question was, one, how to understand the weights between China and America. So I think that I just showed here in this svyset command. So each weights means something. How the weights are derived by the studies themselves are somewhat different. So what are the whether it's gender or age or urban, rural, what are those kind of characteristics that they're trying to maintain proportionality of in their different surveys is different. There is information about how all of those are derived in those harmonized code books that you can download, so you can find that. But we don't produce weights ourselves here at the Gateway. We just refer to the weights produced by the studies. So it is important to know how the different studies produce weights. But inside of Stata, you would just write this command to tell Stata that they were derived differently, basically. That a weight of 1.2 in England is in no way, doesn't correlate to a weight of 0.8 in China, right? So that's basically what that means there. And the second question was, this command has been given in the data or has to find myself using Stata. The svyset command is you would have to find yourself using Stata. The dataset just have the values. There is some information in the harmonized codebooks, but really I would say just knowing Stata, maybe taking a Stata class if you're unfamiliar with it. Also, although I'm using Stata today, both these studies distribute their data in SAS data and SPSS format. So if you're more familiar with either of those, you could certainly use those to do analysis in. SPSS is quite a bit easier. It's kind of more of a point and click one, so you wouldn't have to actually know the commands yourself. You would kind of point and click to find your way through SPSS. But it would take knowing how to write this command. And you can do that using, there's lots on YouTube or using tutorials, just like this one you're attending now. So hopefully you're getting some ideas about how to program this inside of Stata. All right, so yeah, so we estimated this just for anyone 50 and over in our two samples. But let's look, just lastly as we wrap up, let's look at this to see if there's a different age pattern in different countries. So we're going to use exactly the same command here. So if subpop here over country, and this should say over country and over our age categories here. And what that's going to do is it's going to give us 8 estimations. So we have 4 age groups for Charles, 4 age groups for ELSA. So we're going to get 8 estimates there. Again, this should say country or country and the next word there should be age 2005 age category. And then we can test that subpopulation difference. You can see inside of Stata, here I'll highlight how this is written there. So right here you can see over country, over age 2005 age category. So we're going to get our 8 subpopulations. So subpopulation 1 is going to be people in their 50s in China. Subpopulation 4 is 80 and over in China. Subpopulation 5 is 50s in England. Subpopulation 8 is 80s and over in England. So we know what China looks like because we've looked at that previously for that first part of our webinar. But you can see, although we do see much lower levels for all of England, it looks like we might see a different pattern. So one thing, we tested the difference between the youngest and oldest age groups for Charles, and we saw that there was a statistically significant difference in those estimates. And we can here again test whether there's a difference, but for England this time. So we can use an adjusted wall test comparing subpopulation 5 to subpopulation 8. Again, so for people in their 50s in England, or couples for 50 in their England, we would estimate that around 19% provide financial support to their children. And then in their 80s, we would estimate that around 20%. So it looks not that different. And again, that is what we find when we do this adjusted wall test. So we're going to see that it's not a statistically significant difference between the two. And if we want to look at this graphically, because that is almost always easier, what you can see is that the age is very correlated inside of China with how people are giving financial support or whether they're giving financial support to their children. And it really doesn't seem to be, or if it is, not in the same way inside of England. In England, it actually looks like it kind of starts out pretty maybe low, actually, in their 50s, then it increases, maybe not significantly, though, but I think it probably looks like, based on these confidence intervals, maybe statistically significantly different between people in their 50s and in their 70s. And then it kind of decreases again in their 80s. So there's a different pattern that we see in England and China. So this might be a good place to get started on analysis to then test what is the kind of the effective difference. So as people get older in China, they're relying less of their income perhaps is going to their children, and it fairly seems to be constant or kind of has a curve, an up and down curve in England. And so how might this affect people as they're saving themselves for retirement or they're providing for their own retirement? What are the effect of these? So I think this is an interesting question. And of course, this is a really simple analysis. We're basically just doing means here. You probably we want to control for a lot of other things, like that maybe just the number of children people have. It could be that there are more couples or have children at different ages than China and England. So you want to look into a lot of different things, but this is just a way to get started. We have one more question from Bowen. May I know how you draw the plots? Did you use data to draw them? Yes, I did use data to draw these to draw these graphs here. If you would like, this is just some Stata command that I wrote, and it's not included as part of the do files. But if you want to just let me know, if you send me an email or just tell me here in the questions, I'll be happy to send you the Stata programs that were used to generate these graphs. So you could use them on your own also. Stata has some nice graphing abilities, although sometimes it's a little hard to learn how to use it. So if anyone is interested, just let me know either in the questions or through an email, and I'd be happy to share with you this data code to draw these graphs. JK just asked, can we compare Lassie and Charles? Yeah, so absolutely. That's a really interesting comparison. So currently, I'll go back to the Gateway to Global Aging Data website on this download link. So currently, the only data which is available is from, if you click here on Harmonized Lassie, is the data from the pilot survey of Lassie, which was conducted in 2010. And so it's not the full survey of Lassie. It's not all Indian states, in fact, and it's a much smaller sample. We sometime next year in 2019, we hope to have Wave 1, the baseline of the Lassie data available. So that would be a great time to do that analysis, but you could do it now using the pilot data also, and that's available here. And again, those variables that are created in the Harmonized CHARLS, we have for this Harmonized Lassie pilot data set, which you could download from the Gateway to Global Aging Data right here. Let's see, this is a question from Quinn Zhang. This variable includes transfers to children and grandchildren. Can I tease out the transfers to children only? Not in the harmonized data, you cannot. So one of the nice things about the harmonized data sets is that we do try to point you to exactly how we created things. So let's click on here. If we go to our code book, we can find that variable here is transfers to children or grandchildren. So we list all the variables that we used. So for Charles, you can actually tease out transfers using the original Charles data. You can see these variables listed here from children and grandchildren themselves. That is not true in all studies. In fact, I think maybe for ELSA, they ask it in one question. So often when we create a harmonized variable, we try to kind of take maybe the most common, find a common denominator. So for this variable, it was children and grandchildren together. And so if you wanted something a little finer, often you would need to check whether it's available for that study, and then you'd have to go back to the original data. As I mentioned, we do provide the code, this data code that we used to make this data set. So you could kind of use that from the Harmonized CHARLS data creation code as a way to get all those variable names, because we used just the original survey data like you would also, and then you could kind of tease out, you could change the relations here to perhaps have one variable which only looks at children and one variable which only looks at grandchildren. Let's see. We have a question again from JK. Any financial support available for collaborative work on Lassie and Charles? We do not have any, we don't give grants to any researchers here. We're actually grant funded ourselves through the federal government. So we don't. I do think that there's lots of people who are interested in this data, but I think it would probably take writing a proposal and finding some money on your own. So I think it's out there, but we don't provide any financial support to do that currently. And Bo Yan asks, what may be the easiest way to transform the data for M+? Sorry, I have not learned data yet. That's absolutely fine. As I said, the data sets are distributed in SAS, Stata, and SPSS, which is not everyone uses. I know we have a lot of people who also use R who ask about how to use that. Some of it can be done just by Googling, reading SAS data sets into M+. The other way is through a program like Stat Transfer. So that's a program that takes data sets from one format and the other. It is a paid, I'll show you here my version of it. This is called Stat Transfer. So you can take a Stata data set in one file and you can change it to any other file. So you can see M+ is an option here. So you can do that yourself. Unfortunately, this is not a free program, but it's a very helpful program that we use quite a bit here. Or you can often find just Googling the commands you need. And it might be that you take this data set, you read it back into CSV file, and then you can read a CSV file into M+. That's also possible. You can follow up with me if you need any particular help around a certain one. I can kind of help you figure that out also. JK asks, I guess we can use all these data for publication purpose. Absolutely. That's what we hope that people do. May I know how to acknowledge? Yes, we would really appreciate if you acknowledge what we do. In the harmonized data sets, and also when you download the data itself, one of those things, we have a page here called requested acknowledgement. So we just ask you to include this, in this case, this would be 2 sentences here about the harmonized CHARLS that you used. It's important because we want to say which version of it you used, because the different versions can change. And if you could list the grant numbers, we are federally funded here in the United States. So we have to prove that people are using our data and it's being useful and helpful. So please do acknowledge us in any publications that you have. Melinda asks, as the harmonized CHARLS data is available, we don't have to use the Wave 1 through 4 data year by year, right? Just using harmonized 1 is okay, thanks. So I think, Melinda, correct me if I'm wrong. I think what you're asking is, can you just use 1 year? And like we used the 4th year here, but you're just asking about using year 1. If that's what you're asking, yes, that's absolutely fine. And actually what we did today was just kind of a cross-sectional analysis. So we didn't kind of use the longitudinal nature of CHARLS at all. So one thing you could do if you wanted to use the longitudinal nature was to say to look at how maybe someone changed from wave 1 to wave 4. But I think what you're asking is, can you use it cross-sectionally? Yes, and cross-sectionally, you can use it for any of the 4 waves, which is what we did here. Zachary asks, are harmonized variables only created when they are available in all datasets? No, but that does factor into whether they are created. So things that are more available, we kind of, in more datasets, we kind of prioritize higher to be included. Also, if there's things included that are not included that are of interest to you, send us an email. I'll go to my last slide briefly here, which just gives you our help desk email. So if you have any questions, you can write us at this help desk email, which is just help@g2aging.org, and we always try to get back with you. And also, if you have suggestions about this is a set of variables I'm interested in, if you could add it to the list to be added at some point, we really appreciate when users let us know how best we can use our time here. So you could certainly let us know there. But I'll say that there are variables, of course, which are particular to different sections. So, for instance, we have the Huku region, the Huku status here for China, and of course, this is a variable which only exists in Harmonized CHARLS. But because we know that it's quite important to people studying aging and retirement and health and economics in the Chinese setting, this has been included here. So some of them, not certainly the harmonized data sets don't contain all of the variables. We try to focus on those variables which are most important for research and are able to be compared across different studies. Pi-Chun asks, are the harmonized childhood variables in the harmonized CHARLS data? Yes. So I used for this example the harmonized CHARLS data, which is currently available from the CHARLS website, and we used those. Maybe are you asking harmonized childhood variables? Maybe you could specify exactly what you mean by childhood variables. So we used here a variable about the children of the people who were in the CHARLS survey. But I'm wondering if you're asking about if there's variables which have information about what their childhood was like. Pi-Chun, if you could just maybe specify, I can certainly answer that one. Yang Zhao asks, do the CHARLS have a blood test data in 2015 wave? Yes, I do think that they do. Although it is currently not included. You should check that because I'm speaking a little bit off the cuff. I do think they do. It's not currently included in the Harmonized CHARLS dataset. That's one of the things that we're working on now, is we're building in a new section into the Harmonized CHARLS, which includes the biomarker information like blood tests. We built it into some of the other surveys, and so we want to be adding it to CHARLS also. But to find that out, you could just check the CHARLS website again for 2015, and you could look at their different data sets. You could look at that in English also. So let's see, family information. You can get all the data sets in one file. Yeah, so they do have a biomarker file, which I do think would have that blood information, but you need to download that just to be sure. I just got a note that said the link is not working to CHARLS. I apologize for that. It should be that if you go to the Gateway website, that link should be working. Sometimes they change that. So if you would use that link, I think you'll be okay. And Pi-Chun said, I meant the data from the life history in wave 3. Yes, childhood environment, experienced hunger. I understand what you're meaning, Pi-Chun. So that information is not currently included in the Harmonized CHARLS. We have another project which is building in all those variables, particularly around negative experiences growing up. So as you mentioned, whether they experienced hunger, danger, or whether their parents had any kind of disorders, whether they smoke or drank or gambled. We're currently here building that information. So it will be added. I think our plan is to have that added by October of this year and released. So that will be coming. That's actually one of that'll probably be the first update to this version of Charles, is we will include those childhood variables, but they are not in there now, and they will be from the Wave 3 life history version of Charles. Abby asked how to use weights in Charles. So in part 1 of this analysis, I showed you kind of how to specify the weight to use. There's more information about the weight itself in the Harmonized CHARLS codebook. So if you go down in the codebook, we can find here person level analysis weights, and you can find out a lot more information about how those weights were constructed. These weights were constructed by the Charles team themselves, so you can also go to their website to find out information about how the weights were constructed and how they suggest using them. You'll notice that they have weights for the biomarker sample, and then weights with different kinds of adjustments. Let's see, Syed Raza asks, there are cross-wave differences. For instance, in monetary variables like income in Charles, we have before-tax income in Wave 1. But in later waves, we have after-tax income. How to solve this problem for Wave 1, since we do not have tax information for Wave 1? Yes, so this is definitely a problem when studies change how taxes are asked. This is also, there's a European study called SHARE, which has a lot of the European, kind of more than 20 European countries in Israel, and they change whether they ask before or after taxes. So how people deal with that. So for SHARE, what they actually did is the SHARE team produced estimates kind of for Wave 1. They went from pre-tax to post-tax, and they provided pre-tax estimates. They provided pre-tax estimates for Wave 1 based on some calculations of the things that they knew about those people and where they lived. But they are estimates. That work is actually, to be honest, it's not easy to do. So it's quite an undertaking. And I think, if anything, I might suggest getting in touch with the Charles team themselves. You can find their email on the Charles website to get more information to them. I mean, maybe someone has gone through and kind of dealt with this tax issue. And Charles, this is not something that we have done. And it's not kind of inside the scope of what we do to produce tax estimates for China as part of the harmonized data sets. But those differences are really important to notice. And Abby, just kind of as a follow-up, asked how to use weights in Charles. Does it relate with the variables? So yes. So depending on which, you want to use the weight that relates to the variable in particular. So you can see here, there's a different sample for biomarker, so they have a different weight. So if you're using, if you're looking at a variable which comes from the biomarker sample, you want to use the biomarker weight. If you're using a variable which is respondent level, you want to use a person level analysis weight. If you're using a household level analysis weight, as we did for this, for our kind of sample analysis here, you want to use that household analysis weight. JK asks, is there any collaborative group working on these data? I think there's a lot of groups that are working on this data. There's kind of no central place that I know where it's kind of listed out. I would say we have a Facebook group which you join, and people do kind of talk a lot, and it's people using a lot of this different data. That to me is the kind of, that's the one that I would know the most about how to use. You can get a link to our Facebook just from our homepage. Here, if you click this Facebook link, it'll take you to sign up for our group there, and you could ask there if there's any other people. We have a couple hundred users there. If there's other people doing kind of something that you might be also interested in. Rume asks, are all the handouts available on the Gateway website, including previous webinars? Yes, thank you for reminding me. So on this documentation tab, we have a section at the end here called recent presentations. So you can see here we've got several of our latest webinars. We've also got examples in SAS of a similar analysis that can be helpful. And this is also where I will link the slides and the video and the data code for today's webinar. It'll be up there by within 24 hours of this webinar. So you can go there. Zachary Baker asks, any tips for working with multiple data sets included in G2 aging when the variables we want are not yet included in the harmonized data sets? Yeah, so there's often going to be variables which might be of interest to you which are not in the harmonized data set. And so I think what you want to do there in general is I would say you probably want to start with the harmonized data set. So for instance, let's say you use the Harmonized CHARLS, and then I would merge in, so in this case it would be a merge, any variables from the original CHARLS data into that. And that would be kind of a single data step. And then you would say then merge in perhaps a harmonized ELSA, for instance. And that harmonized ELSA might have also been pre-merged with the ELSA data. So it's not hard to do at all. It's literally just merge, and then however you want to specify the merge, depending on whether the data you're merging with is individual level or household level. But you kind of have to do it in different steps. So let me know, Zachary, if I answered your question. Hopefully that I did. Helen asks, when could the exit interview data of 2015 be released? I assume you're asking about CHARLS exit interview data, and I do not know CHARLS release schedule at all. So I would say follow up with the CHARLS team. I think you are correct, as much as I know, is that it has not been released yet. So it's not incorporated yet into the harmonized CHARLS, which is why I know that into this latest version. But whenever they release it, we will include it. But it is up to their discretion when they want to release it. Abby Shin asks, should we use weight in all analysis? How about regression analysis? Yes, absolutely you should use weights for all your analysis. There's different reasons for that. For instance, with the HRS, there is an oversample of Black and Hispanic respondents. So there are more Black and Hispanic respondents proportional to the U.S. population. So you want to make sure that you're not if you just use it without a weight, your results are going to be more representative of those two communities than the United States is, and that will give you a bad estimate. Also, as I mentioned, there are certain groups who do not respond to surveys. For instance, like men of a working age are much less likely to be interviewed. So you really want to make sure to use weights for oversample, and both because you have, it's called biased non-response. So certain people won't be at their household or aren't able to be found, or certain people refuse interviews. And those are kind of in a way that could bias your results. So in regression results, or any means, you always want to look at those weights. Okay, Zachary, I'm glad I answered your question. Abby Shin asks, in CHARLS version C, there is no variable HWGK care in wave 4. Can we get the related data? So let me just look for that variable in the codebook. That's how I would look for this. Yeah, and this is a weather gave. I think it's this one of whether gave care to parents or parents-in-law. I'm assuming, and it looks like maybe it was not included in wave 4. We try to highlight any cross-wave differences. Yeah, here we go. Here in this section, we have cross-wave differences. So we say here, this is on page 359 of the Harmonized CHARLS Codebook. In wave 4, the questions regarding whether the respondent took any time caring for their grandchildren in the past year is included in the questionnaire. However, the current CHARLS Wave 4 public dataset does not contain any values for the corresponding variable, so therefore we don't build this variable. So in this case, it looks like it was in the survey still, but for whatever reason, Charles decided not to release this as part of the public data. And Charles decides what data is public or not. So I know that we have, in this case, followed up with Charles to ask if they would release it, but we have not heard back yet. If you are interested in using this, I would encourage you also to get in contact with the Charles team. I can show you where to find their email also. It's this contact us. So it's charles at pku.edu.cn, Charles at Peking University, EU, China. So send them an email, let them know that you're interested in that 2004 value for why they're providing that, and then we would certainly build it in as in the next update to the Harmonized CHARLS. Melinda Zhang asks, if we use the wave data, shall we also use weight, and what weight should we use? Yes, so you should always use the weight that corresponds to the wave of your analysis. So again, if we look at person level weights here, so if you're using, so say, just an example, how about using income in wave 4, like wages, let's say wage income. So that's something we think about, that a respondent receives a wage on their own. So we're going to want a respondent or a person level weight. We're going to make sure that it wants to be, that it's from wave 4. And in this case, we want to, I would want, as a researcher, to have household and individual non-response adjustments. So we would use this weight here, R4WT RESPB. Charles does also, if you were interested in looking at something longitudinally and not just cross-sectionally, Charles does provide a longitudinal weight for people between wave 1 and wave 2. So that's available here also. So let me know if there are any other questions. I also saw that Abby Shin, you had your hand up, but I think I might have answered your question already. If not, please just let me know. I'm gonna just raise your hand again and I will answer your question, or I'll unmute you and you can talk to me with your voice also. Zumishi asks, how was the date of birth created? So again, if we just use our codebook here, we can go to birth date, month, and year. We have the birth, the month, and the day, which are provided by Charles. And then we have a flag also. And in this how created text, you can figure out exactly, you can find out exactly how it was created. So in particular, I think the more interesting things here, so RAB year takes the respondent's reported age if the birth year is missing. So people are asked their birth year in particular, right? And if they're also asked their age separately. So if their birth year is missing, we calculate their birth year from their age. If both are reported, we just take the year as self-reported. And then in wave 2, Charles asks respondents to confirm their birth year, whether it was correct or not. And if they recorrected it, then we use their correction, but we include in that flag variable that it was changed. Then starting in birth date is actually complicated. And Charles, starting in wave 3 and wave 4, Charles asks for the birth date on their ID card. Of course, this can be different from their actual birth date. For several, I'm told, for several reasons. So we also include that separately as the birth date from their ID card. So depending on what you're looking at, that might be also the place to look. Marco Salome asks, what psychiatric variables are available in CHARLS and ELSA? So for psychiatric variables, one place to look, which I haven't mentioned, on the Gateway to Global Aging Data for what variable or for what kind of survey questions are asked, is on this same documentation tab. We have kind of these tables to compare things. So one of them is health here. We also have stress and psychosocial content. So that might be somewhere you would want to look, but also inside of health, I think there are mental health questions. So we have inside of both Charles and ELSA, for instance, CESD, which is a depression measure, is asked. And there are questions about whether ever having been diagnosed with an emotional, nervous, or psychiatric problems. So you can find these in both of these data sets. You can also kind of look through this table to find ways these are compared. Those are the two, kind of that depression scale and then the self-reportive diagnosis. Those are the ones that are built in. But I would also say if you would visit the that stress and psychosocial content. There are questions there about, I think maybe it's ongoing stress, where they have questions about financial strain, housing problems, close relationships, alcohol and drug abuse. So this could get to some of those other kind of measures that you might want to include if you're looking at psychiatric disorder. Some things like loneliness too. Bowen Zhang asks, I remember that RAND HRS made imputations, but it looks like Harmonized CHARLS does not. Would you use any imputation in the future? Yeah, so CHARLS does not currently impute their economic variables like the RAND HRS does. I know that they are thinking about it. I've had talks with them about doing it, and it's something that they're thinking about doing because imputations are really important because you're going to get a lot of missingness, especially with economic variables. And CHARLS does include unfolding bracket questions, which if you're not familiar, that just kind of means if someone says that they do have a checking account, but they don't know how much is in it, then the interviewer can say, well, is it more than a blank number, and is it less than blank number or about blank number, right? So you can get an idea of where the true value lies, which is perfect for imputations. So I think it's unfortunate that there's not imputations already for CHARLS. I would absolutely suggest imputations. If you are familiar with imputations, I would suggest definitely doing your own. But I know the CHARLS team is thinking about releasing a full set of imputations. So hopefully that is coming, but I have not heard any updates as to when. You might want to check with them. Human Lou asks, the income data has been adjusted by CPI. The data I calculated, The data I calculated showed the income was lower than 2001 and 2013. Is this correct? The data has not been adjusted by CPI in the Harmonized CHARLS data set. If you're just using the raw data, we do include the inflation multipliers. There could be different reasons why you would see income being lower in one year than the other. For instance, if CHARLS hasn't resampled people, then people are going to be getting older, and more people would be going into retirement, which might mean their income is going down. So that could be a reason you're seeing lower income in 2011. We do have graphs and tables which allow you to generate things quickly to kind of get an idea. So let's look. We could also look at this. So we can look at individual earnings in China for our 4 waves here. We don't need a subpopulation on this. So it looks like that's not what I'm seeing. So one thing could be maybe check to make sure that that you have weights. So what I'm seeing is in 2010, the mean was 5,200, and then 5,400 in 2012 and 5,700 in 2014. Oh, and in this case, this actually is inflation adjusted. So this is all expressed in 2010 currency. So in our graphs, so once you adjust for inflation, perhaps it does look like it's rising still. So I think you might just want to check the data itself. That would be my suggestion. Are there any other questions, or is there any question that I have missed? Thank you guys for all these great questions. I'm glad that you are interested in this data, and hopefully this webinar has been informative. As I said, if a lot of this was new to you, I would suggest going back and looking at maybe our introductory webinar to kind of get a sense, maybe if you're only familiar with Charles, of what are the other surveys and how might they be different from Charles, and what are kind of interesting research questions you could ask by using this data from different countries. Marco Salami asks, are you available in helping run analyses? Marco, we definitely want to help you get started on your research. But because we're trying to constantly add to all these harmonized data, both when new data becomes available and to add new measures, we are kind of pressed for time here ourselves. So we cannot run any analyses for you, but I'm happy to help advise you to get you started in the right direction, or to maybe suggest some sample data code or something, but we wouldn't run anything for you on our own. For instance, you couldn't say, can you check this number for you? Yeah, advice, absolutely. And the one way that we do try to provide to help you run it, of course, is this graphs and tables, which does basically a lot of it in the background. It's not available for all the survey measures, but we tried to build a tool for people who might not be familiar with, let's see here, mother alive in different countries here. For people who might not be familiar with the data themselves. And for instance, here's a graph of whether someone's mother is alive, and we could look at this over different subpopulations or different age groups in different countries. And so that's kind of our way of running analysis for people, but it is somewhat limited. But if you just want advice about how to get started, absolutely send us an email at that help desk, or you have my email from this webinar. You can email me, absolutely. Are there any other questions? All right, well, if no one else has a question, then I'll go ahead and wrap up this webinar. Thank you all for taking your time and joining us. I'd encourage you to use the Gateway to Global Engine data and the Charles data. I think they're great resources. And please email us if you have any questions about getting started or finding access to the data. And again, if you have any colleagues this presentation or webinar would be useful for, I encourage you to kind of point them to our website also. But thank you again for spending the last hour with me. I'm glad you all enjoyed the webinar. Thank you. I appreciate that.